Welcome to Get Frazzled presents Erectile Dysfunction for Patients. We will discuss the many treatments available for ED, including oral medications, injections, an intraurethral pellet, the vacuum device, and inflatable prosthesis. We will also discuss options for women. But first, let me bring you back to the dark ages of medicine, at least as far as ED is concerned. Let me bring you back to 1997. I was a resident physician in 1997, the year before Viagra came out. Back then, ED was called impotence, and no one wanted to talk about it. The patients certainly didn't. Men felt ashamed and alone. The doctors didn't want to talk about it either, because we had very little to offer besides empathy. But two things happened that year that would be game changers: FDA trials for Viagra and FDA approval of direct-to-consumer marketing. Viagra was approved in 1998, and the little blue pill was born. The medication cost $8 to $10 per tablet, cheap by today's standards, and most insurance companies covered it. Pfizer made a ridiculous amount of money, but they wanted more, so they brought out the big gun. They brought out this guy. Hey, it's Senator Bob Dole, former Republican nominee for President of the United States. His Viagra commercial opened a discussion about sex and men's bodies in a way never before seen. If someone as respectable as a Republican nominee for president can allude to his penis, then it's okay for all of us to discuss this. And yes, I know every millennial watching this is chuckling right now, but trust me, in the late 90s, pre-Donald Trump, this was a big deal. After Viagra came Levitra with the oral disintegrating form called Staxin. This was closely followed by Cialis and more recently Stendra. By 2012, ED meds had a worldwide market of $4.3 billion. One might reasonably assume, following the immutable rules of capitalism, that the price of these drugs would go down given the increased competition. They did not. Here is the average price per tablet in 2014. Even worse, most insurance companies no longer cover these medications. The prices still remain high in 2017, but there is hope in the future. Generic Viagra is set to come out by December 2017. According to the prescriber's letter, 10 different companies plan to come out with a sildenafil tablet. Unfortunately, only one, Teva, has exclusive rights to do so for the first 180 days. So maybe by late 2018, we'll see enough competition to drive the prices down. A generic Levitra is due out in October 2018, so there is reason to hope. Until then, that erection will cost you. Let's talk medical. All of the PED5 inhibitors increase blood flow to your penis to make it easier to obtain and maintain an erection. Officially, they work within 30 minutes, but most men will feel a difference within 15 minutes. The medication stays in your system for 5 hours. Cialis is the exception to this. It takes up to 60 minutes to work, but stays in your system for up to 36 hours. 2 decades of data have proven these medications to be safe, but there are drug interactions and one potentially fatal one. Do not mix this with nitrates. This includes nitroglycerin, commonly used in heart disease, and amyl nitrate, also known as poppers, a popular sex aid in the 70s. Side effects of PED5 inhibitors are listed on the slide and include nausea, rapid heart rate, and visual symptoms. In 2007, sudden hearing loss was added to the list. Before we discuss alternate treatment options, it is worth noting the risk factors for ED. Smoking, alcohol, drugs, and obesity are all modifiable risk factors. Addressing issues of stress and treating diabetes, hypertension, heart and vascular disease will also help. Unfortunately, some medications can also cause ED, especially meds for high blood pressure and depression. According to the Mayo Clinic, the 4 natural products listed on the slide have shown some benefit for ED and are generally considered safe. Yohimbe also has shown benefit but is less safe and should only be taken under medical supervision. Avoid so-called herbal Viagra, which has unknown ingredients and can be dangerous. Viagra sold on the internet for $1 a pill is in this category. Don't risk death. See your doctor instead. Unfortunately, PGE5 inhibitors don't work for everybody, especially if your ED is due to prostate cancer, surgery, stroke, or very severe diabetes. At this point, your internist will refer you to a urologist, and these are your options. 1. Penile injections. Men always cringe at the thought, but every guy I know who has done this says it's not that painful. This method is highly effective, but has a greater risk of pain, scarring, and priapism. Priapism is an erection lasting more than 4 hours. More on that later. 2. Muse. A small pellet is inserted into the tip of your penis with a plastic applicator. Risks are a burning sensation and priapism. 3. Vacuum pump. This is a pump that goes over the penis and creates negative pressure, resulting in increased blood flow to the penis. A rubber band is rolled off the vacuum pump onto the base of the penis to keep the blood trapped. This should not be left on for more than 30 minutes. 4. Penile prosthesis. An implant is surgically inserted inside the penis, which you can pump up when needed. The pump is placed inside the scrotum, so there are no external parts. No medications are needed, nor does it affect sensation, orgasm, or ejaculation. There is an alternative semi-rigid prosthesis available for men unable to use a pump due to severe arthritis, stroke, or other neurologic disease. Speaking of priapism, here's my novel, Didn't Get Frazzled. For those of you who haven't read the book and don't get the joke, there's an entertaining story in the book involving priapism, 2 medical students, and a gentleman on the prison medical ward. No spoilers, but you can download the ebook for only $3.99 and read it for yourself. Since you made it this far into the video, you're clearly not the squeamish type, and I'm confident you'll like my book. Please check it out. So what about the ladies? The search for a little pink pill has been the wet dream of every pharmaceutical CEO worldwide. You can check out the documentary Orgasm Incorporated if you're interested in that story. Beyond lubricants and vibrators, there is only one FDA-approved medication for women, Addy. Originally developed as an antidepressant, Addy may boost sex drive in premenopausal women. Local estrogen therapy may help postmenopausal women by enhancing lubrication and increasing vaginal blood flow, tone, and elasticity. Testosterone is a controversial option with conflicting data that is not currently recommended. Thank you for watching Didn't Get Frazzled presents Erectile Dysfunction for Patients. For additional information, go to my website, davidzhurst.wordpress.com, and click Videos. There you'll find all of my videos along with hyperlinks with more information on the issues discussed today. Please like the video and click subscribe so you'll be notified whenever I post another detailed video on common medical conditions. I wish you all good luck and good health.